Naturopathic medicine is a distinct profession of regulated primary healthcare providers. So as a primary care provider, I can assess, diagnose, and treat many common conditions very similarly to a family doctor or nurse practitioner might. I use both conventional and naturopathic laboratory tests when indicated, as well as other diagnostic tools or methods such as imaging and physical exams, including your routine screening exams and focused clinical exams. As a naturopathic doctor here in BC, my scope of practice is fairly large in that it includes access to important diagnostic laboratory assessments, and treatment modalities may include clinical nutritional counseling, custom compounded botanical medicine prescribing, and safe and effective supplementation with vitamins and other nutrients. Additionally, I've obtained additional certificates to practice intravenous and intramuscular injection therapies. I've also obtained my acupuncture certificate and use both traditional acupuncture as well as dry needling or IMS in my practice. I also have my pharmaceutical prescriptive authority, which allows me to use careful prescribing as required and really to help patients with medication management. It's a minimum of 8 years to complete your schooling to become a naturopathic doctor. And I received my Bachelor's of Science in Exercise Science before attending an accredited naturopathic medical school. Additionally, I passed a number of standardized board exams before being able to practice naturopathic medicine. As a naturopathic doctor, I'm licensed and regulated under the College of Naturopathic Physicians of British Columbia. Having regulation is crucial for public safety, and this organization ensures that all naturopathic doctors, such as myself, practice ethically, safely, and competently. They essentially set the standards of practice for our whole profession. As a regulated health professional, I'm always willing and happy to work with other healthcare providers, such as medical doctors, specialists, chiropractors, physiotherapists, and others. My intention is to improve the quality and continuity of care within this multidisciplinary setting. First, we need to ultimately define what evidence-based medicine is so that we can be on the same page. So essentially, evidence-based medicine is integrating three main factors: the person or the patient's values and their belief systems, the doctor or clinician and their clinical experience and their expertise, and the current science and research. When we really integrate these three things, we can have what we call a shared decision-making conversation. So it's my job as a naturopathic doctor to provide informed consent before introducing any sort of treatment. This means educating my patients about any known risks, benefits, limitations, and so on. Ultimately, this allows the patient to make an informed decision and to be an active participant in their healthcare. The foundations of naturopathic medicine include addressing the determinants of health, so things like quality sleep, proper nutrition, adequate movement and exercise, social connections, and stress management. Research has really consistently shown that these determinants of health really do lay the groundwork for all of well-being. I always understood from a young age the importance of physical and mental health. Growing up as an active, athletic female, I experienced firsthand the effects that physical activity and proper nutrition had on my physical health, but not only that, but the social connection and sense of community from playing team sports and the effect that that had on my mental health in terms of building self-confidence and resilience. So when I began studying the human body more in my exercise science undergraduate degree, I discovered a medical profession that was essentially founded on these philosophies and beliefs that I had myself about health and wellness, and that I was continuing to learn from a scientific and research standpoint during my studies. By using lifestyle medicine as a foundation, the naturopathic philosophy is to stimulate the body's natural healing mechanisms and to treat the underlying causes of disease. We have a saying in naturopathic medicine: it's more important to know a person that has a disease than the disease a person has. The focus of naturopathic medicine is really on treating the whole person from a holistic standpoint and providing a personalized approach to care. It's these principles, amongst many others, such as doctor as teacher and focusing on prevention, that has really resonated with me in a pretty powerful way. This is why I absolutely love what I do as a naturopathic doctor.